Good morning. Welcome back to Morning at 10 TV. My name is Malaki Vilodera, and today we are having a very pertinent issue that we need to talk about. And remember, the engagement platforms are on Twitter, Facebook, and YouTube. So on Twitter, you can tweet us. The hashtag is Morning at 10 TV. On Facebook, you can reach us on NTV Uganda pages and drop off your comments. You can also stream us live on YouTube. So let's talk about this. And the topic today will be on why you as a couple should go for blood screening before you get children. It doesn't matter whether you're married or not. And so in studios to talk about that and to give us this particular reasons as to why we should take this issue seriously is Dr. Philip Kasirie, who is a pediatric hematologist. Thank you so much for coming in studios.
Thank you too, and good morning, viewers.
Thank you so much. A report was actually released just the other week, and it shows that annually over 30,000 children in Uganda are born with, blood diseases, hematologic, diseases, disorders. Why are we having this? Is it that couples don't know? And what are these diseases?
Thank you very much. So, that is true that many couples are giving birth to children with disorders, and as such, blood-related disorders. And some of these may include diseases like sickle cell anemia. There are other diseases that are associated with bleeding disorders. In other words, children with conditions whereby their body cannot actually form a clot once they are hurt or injured, and so they bleed for longer periods than usual, which may predispose them to complications, like bleeding in different parts of the body, and also bleeding and losing excess amounts of blood, that they may die from such complications. So, generally speaking, I think the concept of testing for conditions that may predispose to blood-related disorders or diseases has been low, other than the testing for HIV. And so it is pertinent that we discuss this and let the people know that there is more to check than for HIV. Okay? For example, if I may start with sickle cell per se.
Yes.
It is the fact that sickle cell disease is a genetic disease. It can be passed on from parents to their children or offsprings. And that if you tested and determine whether you are a carrier of the sickle cell gene, the gene that predisposes to sickle cell disease, if you tested and you found that you're a carrier, it would be advisable not to for example, marry and proceed with procreation with a person who's a carrier.
Okay.
That would put you at a risk of having 25% chance for every pregnancy of having a child with sickle cell anemia. What does it mean? It means for every pregnancy you have 1 out of 4 chances of having that child with sickle cell anemia. It has happened in such a way that you find a mother having the first child has sickle cell anemia, the second child has sickle cell anemia, the third child has sickle cell anemia.
Wow.
It doesn't matter, it does not relate to the number of children. The chance relates to each pregnancy. So the risk is present for each pregnancy.
For each pregnancy.
Yeah.
Now, what happens in the event whereby two people have met, they're in love, and they really want to go down that route of having children together? So if they come for testing and both of them are carriers, what next? As doctors, do you advise them to part ways, or what exactly happens after that?
Okay. Thank you very much. In such situations, we are obliged to give them adequate information regarding the sickle cell per se, in this case, and show them the real risk and what it means to have a child with sickle cell anemia. Having to spend all their lives, the children's lives, when you're anxious about the pain attacks, about the complications, stroke, infections, the stigmatization related to the challenges they have with regard to growth, having to fall sick and miss school every now and then. So once you tell the people that, well, this is what is associated with this condition, and you give them the ultimate, the best information, you leave it up to them.
Yes.
We do the counseling, give them the adequate information, and leave them to make an informed choice as such. And then there are other conditions, blood disorders or bleeding disorders.
Before we go to that,
Yeah.
maybe I think there's someone watching and they really don't know what sickle cell anemia is. Could you just, in a brief, kind of explanation, tell us what sickle cell anemia really is?
Okay. Thank you very much. So sickle cell anemia is one of the blood-related conditions that are associated with the acquisition or passing over of the sickle cell gene. And when the sickle cell gene, when the child acquires one sickle cell gene from the mother and one from the father, the child presents with the two sickle cell genes, and that presents with a conditions, disease state conditions. These children may present with frequent episodes of anemia, low blood levels. They may present with yellowing of eyes as a result of repeated breakdown of red blood cells, and therefore contributing to the low blood levels. They are prone to infections. Sometimes, if not controlled, they may have dysmorphic features, big head, small limbs, the legs, the hands, which is highly stigmatizing. And basically, it follows the sickle cell hemoglobin. Hemoglobin is the red pigment of blood. It's what confers the red color to the blood. It is contained in the red blood cells, small round cells, and its function is basically to help in transporting oxygen from one part of the body to the other.
Right.
So when you have sickle cell hemoglobin, you have an abnormal type of hemoglobin. It does not function well in terms of oxygen transport to the different part of the body to nourish the body cells, and it renders the cells easy to break down and easy to come together and block the vessels. So that's what causes the different components of the sickle cell disease. The pains when they block the blood vessels, and therefore the body parts cannot be well supplied with oxygen.
Yes.
And then the anemia when these cells break down, and the yellow eyes or the yellowing of the body when the red blood cells equally break down. So it's not a desirable condition.
Is it a reversible condition, or if one child is born with it, they have to live with it for the rest of their lives? Is it
So the fact is that once they are born with it, they live throughout their life with it. It is not something that you can reverse with treatment, apart from the only one treatment, which is called bone marrow transplant, which ideally would actually make this child less prone to the complications and therefore live a fairly normal life. However, it does not change the body from having the sickle cell gene. It just controls or prevents the severe complications.
Okay.
And by and large, this is largely inaccessible because you're talking in the tunes of about 200, 300 million, which is much out of range of 99% of Ugandans.
Right.
And even then, it does not ensure ultimate success. There are risks associated with it. So that's why we think, we are saying that it is something, by and large, people will be born with and live with.
Let me ask you a question. Once a child presents, actually is born with sickle cell anemia, what are the survival rate? What is the survival rate? What are the chances of that child living to adulthood?
Okay, thank you very much. Previously, in our setting, we used to have survival rates in the ranges of 50 to 80% by age 5. By age 5, 50 to 80% used to die by age 5. In other words, survival ranges used to be 20 to 50%.
Right.
Today, we are having more children, we're seeing more children grow into their adolescence. In the developed world, all their children, almost all, grow into adulthood, 99%. This side, we're increasingly seeing more children grow into adolescent, but again, we lose them around there. So it means we still have a lot of work to do. And one of the work is to prevent.
Yes.
And prevention at the preconception level.
Right.
Before we decide to procreate, if you're in a love relationship and you're taking that route. So that's why you need to test for things such as sickle cell anemia, amongst others.
All right.
Yeah.
Okay. And you're saying that the survival rates outside the country, in the developed world, is, you know, pretty much good. But here, back at home in Africa, it's hard. Is it just because of lack of resources, or is it inadequate research that is being done? What exactly can we attribute that to?
Okay. Thank you. Previously, this whole, like you earlier mentioned, the whole concept of genetic diseases had been, I wouldn't say neglected, but it hadn't been given much attention.
Right.
More so in the developing world. In the developed world, they do newborn screening, and they screen for all diseases that can be passed on to children, or that children are born with, right at the point of birth. Here, the concept is just picking up, largely because of maybe resources. We are resource limited compared to those who have enormous resources. But fortunately, it has been recognized, and the programs are really up in that direction. And that's one reason why we are talking about testing for so many conditions.
Right.
Before you decide to engage in activities that may lead to procreation. And therefore, if we approach it at that angle, we may actually, to a great extent, control some of these conditions.
Right.
And it has always been mentioned that prevention is better than cure.
Right.
And so it's much applicable in this case.
Let me ask you, over and above sickle cell anemia, what other, diseases does, the lack of couples going for testing, what other diseases are children at risk of getting? Okay.
Thank you very much. Among us, the blood-related conditions or hematologic conditions, there are others, and such as the ones that you mentioned about. There are disease conditions that may predispose the child to early death, the newborn child to early death, through bleeding. And this may actually relate to the blood groups incompatibility.
Okay.
If there's mismatch at the level of blood groups.
Of the couples.
Of the couples, and therefore potentially for the newborn. And what are we talking about? We're talking about the common blood groups, ABO, and I think most people know about blood group and blood group A and blood group B and O.
Yes, I'm AB.
Exactly. And also what people may not commonly know about, the rhesus, it's called RH, blood group. So what happens is that, and you can be A, B, or O, and commonly we report it as A positive, B positive, AB positive, or O positive.
Yes.
Or A negative. That negative or positive relates to the rhesus group or RH group. So if, for example, I was blood group B, I'm blood group B, but B positive, so I'm blood group B, rhesus positive.
Factor positive, yes.
So if I had someone, if my wife was, for example, negative, had rhesus negative, for example, O negative or B negative or A negative, there would be a risk of having an unborn child in the mother's womb who may be positive and the mother is negative. Okay? In other words, the unborn child has a blood group which is positive,
Right.
but the mother's group is negative.
Negative.
So in such a situation, the mother may try to reject this unborn baby right in the womb. Okay? And that rejection is because she tries to form what we call antibodies to fight this unborn baby who is a stranger, who is a foreign body to the mother. And especially if there is mixing of maternal blood or mother's blood and the unborn child's blood. That may lead to several complications. It may lead to actually to stillbirth.
Oh.
Involving the unborn
Because
baby.
of the antibodies of the mother fighting
Yes.
those of the child. Okay.
Yes, especially if there is mixing of blood in the womb. Okay? So if the baby survives that storm, okay, the baby may also have some antibodies, and therefore when the child is born, the child may present with low blood level or anemia and a yellow skin color. Okay? Jaundice.
Yes.
So both of these can also potentially harm the baby.
Does it mean the children who are born with jaundice come from that point whereby the mother was, was rhesus factor negative and the baby was positive? Is jaundice only related to that, or there are other causes of jaundice as well?
That's a very good question. The fact is that it is not only that condition that leads to children presenting the yellow color or jaundice per se or anemia, but amongst the things that can lead to that significantly are the blood groups incompatibility or mismatch, and that involves the ABO and the rhesus group. And so if that is the cause, the child may actually present with low blood levels, and that may die from complications related to low blood levels, or may actually present with jaundice, which may actually also injure the child's brain. Jaundice is a very bad, deep jaundice is a very big condition for a newborn child to have, because it can potentially hurt the brain. And some of the complications later on may be children who are unable to function normally because of an injured brain in the early period.
Okay.
And they may have seizures, they may have problem with posturing, movement, feeding, learning, and things like that.
So their development will be affected significantly.
Exactly.
Now, for example, if we have a mother who has maybe realized that her rhesus factor is not compatible to that of the child, and she's already pregnant, and she goes to the hospital and realizes that. Now, moving forward as medical experts, is there anything that can be done at that point just to reduce the risk factors?
Okay, so ideally, first of all, like we said, it's important to know and test.
Yes.
Okay. And how do you do that? Prior to
getting pregnant.
And then I know if you're in such a situation whereby you're already conceived,
right,
and then it turns out that you are negative and the unborn baby is probably positive, the first child may not be at so much risk, because what happens is that the mother gets primarily sensitized. By sensitization, it means she first makes, she's alerted that this is a foreign body, which you should fight. But the greater risk is for the subsequent baby.
The second baby.
Exactly, whereby having been fully sensitized and energized to fight any similar foreign bodies, it will come, you have an aggressive or strong fight towards any child who may present with a similar condition.
Yes. So what happens
So
in that case, in the
such a
second
situation,
pregnancy?
it would be important to work closely with your obstetrician, okay? And so there are interventions that may be given, treatments that may be given to dampen the effect of the fight, okay? And ultimately, intervention as into the as to whether they can terminate a pregnancy if it is advanced. By termination, I mean to deliver the baby or
Before
not.
term.
Okay, before. I mean, as long as the child is grown to a point where the child can survive outside the womb.
Okay, but you don't terminate it.
Not terminating
All right.
as in abortion.
Okay.
No.
Okay.
So the early delivery, I may term it that way. But primarily, it would be better to prevent getting into such scenarios
Right.
by testing. For reasons, it may involve life-threatening conditions for you and the unborn baby. And secondarily, it is costly.
Let me ask you a question before we go to the cost factor, and of course you'll give us examples of what you face on a day-to-day basis as a doctor. Okay. But when now a mother is in that position whereby she has realized, okay, she didn't know, and many people don't know. They just get pregnant, and of course, like you said, the first pregnancy can be pretty much smooth, the baby healthy, and you move on. Now the second pregnancy comes in, and then you realize that now you're getting sick. You go to the hospital, and you realize, it's because your rhesus factor is fighting that of the baby. Now, in that event, are there risk factors? Like, could the mother lose the baby? Because off camera, you told me that if that is not sorted out early enough, then the mother can even get a miscarriage, suffer miscarriages because of that. How does that relate to a miscarriage? Is it that now the antibodies of the mother fight so hard against the baby?
Okay. So thank you very much. So you may actually, you've rightly stated it. So what happens is that you may have antibodies produced towards the baby. And if there's blood mixing, especially, you find that the child might actually have clots, blood clots. So the blood...
In the womb?
Yes, right while in the womb. So the child has blood that may clot and then develops anemia and dies from anemia in the womb.
Wow.
Okay? So if you don't have adequate levels of blood or hemoglobin, then it means you are at a risk of suffering from complications relating to not having the ability to carry oxygen to the different parts of the body. Because oxygen is the fuel that drives the functioning of most of the cells in the body. If we are unable to breathe, we are unable to live.
Right.
So if you have low, that's why if any condition associated with low blood levels is associated with high risk of death or suffocation. So that can happen in the womb, and you have a stillbirth or a miscarriage per se. So that's how bad it can get, especially if you have a mismatch with regard to the blood groups. Okay?
Wow. Wow.
Yeah.
Okay, and over and above that, now we have a couple who they've come to the hospital to do the blood screening, and it comes out that the blood groups and the rhesus factors are not compatible. Is there any medical intervention that can be made just to ensure that they can still be together, get healthy children? What are the chances of them getting healthy children? What do you tell them once you find that they're not compatible?
Okay, the first thing is, and the greatest thing is always to counsel them.
Okay.
To give them the most appropriate, most up-to-date information regarding of what they have and what it means to have what they have. That's counseling. And what to expect. Okay? So like I said, the first baby may not be at that much risk.
Right.
But at the subsequent pregnancy, for sure, first of all, it will be advisable such a couple and all couples, whether married or not, provided what makes them a couple is if they've really taken that route of having children. So it should be important that they attend antenatal care with a qualified health staff.
Okay.
So
they can still move ahead and have...
Exactly, such
okay.
that they
and
can
conceive.
be
Okay.
evaluated and counseled
All right.
about their conditions. Okay. And secondly, the intervention, the highest qualified in that case would be an obstetrician. Okay. It will be important to be in touch with an obstetrician who's conversant with these hematologic issues.
Yes.
Okay. I know there are preventive measures. They can be given factors that may actually dampen, or drugs that may dampen that reaction, overt reaction. But ultimately, it also has a limit. For the first baby, it may be fine. The second baby, with the intervention, may be fine. But it has a limit. And that may actually point to the health of the mother and the health of the baby, unborn baby. But generally, what I may advise to the viewers is that first of all, screening prior to taking that route, and secondly, attending antenatal care with a qualified person. Okay, that would ensure that you have good counsel and early appropriate attention.
Yes.
Along the way. But if you found that you wouldn't bear the potential consequences, then it would be incumbent upon you to make an informed decision.
Yes.
And that's what we are there to do, to give the information and you decide. When it comes to social relating, that's a human right. It's governed by the principles of individual decision making.
Yes.
When it comes to that,
so
which is informed.
So essentially, when people just meet and they feel like they want to get their relationship to the next level, it's important for them to go for blood screening before they even formalize anything.
True.
Okay. For them that are late, so to speak, and they really don't know this, and maybe it's a newborn, what symptoms should they look out for? Already you've given us symptoms for a child who has sickle cell anemia, but for hemophilia, what symptoms should they look out for in their newborn babies, just to know if they have hemophilia or not?
Thank you very much. The other factor is what you've just mentioned about the other disease condition called hemophilia. But that's usually the other factor that may actually be a pointer as to whether there is an underlying blood-related condition or not, is if you review the history of your, let's say, parents or uncles, your lineage, in your lineage, and as well as her lineage. If you understand each other well, you may be able to detect that there may be factors or disease conditions related to hematologic, like sickle cell, like hemophilia, like especially those ones.
Yes.
And other bleeding conditions like von Willebrand disease.
Yes.
Okay. With hemophilia and bleeding disorders per se, what makes, they relate to the inability to form a clot, a strong clot, when you're injured.
Okay.
And so the newborn will present with easy bleeding status. Like the cord, once they severe the cord, you find that it's taking days to stop, to dry up. Okay? They may have patches, purple, pink patches, which may indicate that the child is bleeding under the skin. Okay? Or they may be related to that, they may have deep yellow color, or they may have spots if they are bleeding under the skin. But if I may go back briefly, our bodies were created in such a way that once we are injured, the body comes into action.
And forms a clot.
And forms a clot.
Okay.
Several factors are important. One is the platelets, small cells. Two, other factors called clotting factors. So when there's a problem with the platelets, small cells that help in the formation of clot and the bleeding factors, it may actually also culminate into a bleeding disorder.
Okay, so parents who have children that present such symptoms should take their children to, you know, hospitals for further investigation. Them that didn't know that they have, you know, those incompatibilities with their spouses. Thank you so much for coming in studios. At least now we know it's important for you as a couple to go for blood screening before you get children. And you're saying even if you're sexually active, it's very important because most of the pregnancies are actually unplanned. So very important right there. Thank you so much for coming in studios.
Welcome.
Yes.
And to deliver in a hospital setting, where a full newborn examination will be done to ascertain whether there are those missed opportunities. Okay,
thank you so much for coming in studios, Doctor. That has been it for Morning at 10 TV. Be sure to catch us yet again tomorrow from 6:30 to 9 a.m. We'll be sure to have yet another educative topic for you. Have a blessed day.
Thank you.